This is The Week in Addiction Medicine, a podcast resource of timely news and top stories brought to you by the American Society of Addiction Medicine, ASAM.
Today is Tuesday, May 5th, and I'm Zach Caruso. Our lead story this week is in the Milbank Quarterly and is titled Medicaid Managed Care Plan Alignment with State Substance Use Disorder Treatment Coverage Requirements. Medicaid managed plan coverage for medications for AUD and OUD varies across states, but is generally lower in Republican-leaning states. Researchers conducted a national survey to evaluate if these differences in coverage were due to variation in state policy or variations in Medicaid managed plan alignment with state policy. Researchers found that while Republican-leaning states were generally a little less likely to require coverage of most or all medications for AUD and OUD and place limits on prior authorization, managed plans in Republican-leaning states were much less likely to follow state requirements. Given these findings, efforts to increase access to medications for AUD and OUD will need to address misalignment between managed care plans and state policy, and not just focus on making changes to state policy. Next is an article in JAMA Network Open and is titled Cascade of Care for Opioid Use Disorder Among Medicaid Beneficiaries. This is a cross-sectional study of 126 million Medicaid beneficiary year observations from 2019 to 2023 that aim to identify trends in OUD diagnosis and treatment. The study included Medicaid beneficiaries between ages 18 to 64 from 47 states and D.C. The percentage of Medicaid beneficiaries diagnosed with OUD decreased from 4% in 2019 to 3% in 2023, with an overall decline in 34 states. Of those diagnosed with OUD, the percentage who received MOUD increased from 60% to 69%, with an increase in 45 states. However, the percentage who continued MOUD for at least 180 days decreased from 62% to 57%. The percentage of beneficiaries with OUD who had an OUD-related hospitalization was relatively unchanged at 10.9% in 2019 and 10.6% in 2023. Our next article is in Drug and Alcohol Dependence and is titled Opioid Use Disorder and Medication for Opioid Use Disorder Among Pregnant Women with Commercial Insurance in the United States, 2016 to 2020. This study examined pregnancies among women aged 15 to 54 years from 2016 to 2020 and the prevalence of OUD diagnosis and MOUD, including methadone, buprenorphine, and naltrexone. Researchers also examined pre-pregnancy clinical factors associated with MOUD in a nationwide commercial insurance database. They found that less than half of pregnant women with OUD received MOUD, the gold standard for treatment. The results demonstrate substantial missed opportunities for MOUD treatment during pregnancy, highlighting the need for targeted interventions to improve evidence-based perinatal OUD care. Our next article is in the Journal of the American Medical Association and is titled Symptom-Based Dosing for Neonatal Opioid Withdrawal, the Optimized Now Randomized Clinical Trial. This cluster crossover randomized clinical trial assessed if pharmacologic treatment with a symptom-based dosing approach decreases time to medical readiness for discharge compared with a scheduled opioid taper for infants with opioid withdrawal cared for with the Eat, Sleep, Console approach. Researchers found that time to medical readiness for discharge was 2.3 days shorter for infants treated with symptom-based dosing compared with a scheduled opioid taper. No difference was noted in safety outcomes through 3 months of age. Symptom-based dosing decreased time to medical readiness for discharge for infants with opioid withdrawal cared for with the Eat, Sleep, Console approach. Next is an article in Addiction and is titled Patient-Reported Outcomes for Monitoring Substance Use Treatment, a Systematic Review of Single-Item Measures. Repeated measures can be useful to monitor treatment and inform clinical decisions, but many validated assessment tools are long and time-consuming. Researchers conducted a systematic review to assess single-item patient-reported outcome measures, or PROMs, as a potential tool in SUD treatment. A total of 35 studies were included in the review, evaluating 68 single-item PROMs and measuring 9 clinical constructs, including cravings, self-efficacy, treatment readiness, and quality of life. Researchers found most of the measures did not have defined clinical thresholds, but measures assessing cravings, treatment readiness, and self-efficacy had the most robust data. While additional research is needed, including longitudinal evaluation, single-item PROMs could be useful in SUD treatment settings given their limited burden and strong psychometric performance. Our next article is in the Journal of Substance Use and Addiction Treatment and is titled Smart Harm Reduction Vending Machines to Improve Public Health, Evaluating the Utilization. This report presents evaluation outcomes from 2 smart harm reduction vending machines, or VMs, placed in community settings in central Pennsylvania from May 2024 to May 2025. The VMs dispense free harm reduction items and also provided information about and linkages to healthcare and other services. A total of 2,300 clients registered and accessed services via the VMs, with 14,800 total sessions. An additional 4,400 non-registered individuals interacted with the machines to view items or resources. The most popular items were hygiene kits, wound care kits, and safer sex kits. 2,700 drug testing strips and 1,900 naloxone kits were dispensed. As harm reduction VMs are implemented in more locations in the U.S., this study provides valuable insights into how they are utilized. Next is an article in Sleep Medicine Reviews titled Actigraphy-Based Sleep Outcomes in Substance Use Disorders, a Systematic Review and Meta-Analysis. While polysomnography, or PSG, is the gold standard for measuring sleep architecture, it's expensive and conducted in the artificial setting of a sleep lab. Actigraphy provides less quantity and quality of information but can observe multiple nights for longitudinal studies in the patient's natural environment. This systematic review identified 9 studies that used actigraphy with control groups to assess sleep in subjects with SUDs. Researchers found total sleep time was reduced in AUD and OUD. Nicotine use disorder was associated with increased waking after sleep onset. Researchers note that the objective actigraphy and also PSG reveals sleep disruption that was not evident on subjective sleep self-reports. These studies using actigraphy produced results similar to previous PSG studies, confirming the accuracy of actigraphy. Our final article is in the Journal of Addiction Medicine and is titled Methadone Diversion and Overdose. What does the evidence say? A narrative review. Efforts to relax restrictions on the use of methadone in OUD often generate concerns about diversion and the risk of overdose. This paper reports on 20 studies concerning methadone diversion. Various studies show 6% to 88% of patients report ever diverting methadone. Reasons for diversion include income and to help others treat withdrawal or reduce opioid use. Use of diverted methadone for euphoria was less common. Studies in countries where physicians prescribe methadone did not show an increased incidence of diversion. Overdose deaths due to methadone also involve methadone prescribed for pain, so the role of diverted methadone is hard to tease out. The authors conclude that overall evidence does not suggest restrictions on methadone access reduce diversion or overdose. This concludes today's episode of This Week in Addiction Medicine. Remember to subscribe to the ASAM Weekly for more exclusive content and our editor's commentary delivered every Tuesday. Be sure to check us out on social media and at asam.org. Thanks for listening. We'll be back next week.